Hi, it's Professor Kristen, and one of the things that can be really tricky sometimes for student nurses, for new nurses, and for even seasoned nurses that haven't done an actual sterile procedure or had to set up anything sterile in a while, it can be kind of tricky and confusing when you're starting to gather different things to set that field up and to remain sterile. So one of the things that I want to do is just set up a very basic sterile field and kind of talk it through just to refresh new nurses, nursing students, and even seasoned nurses. So let's set up this basic sterile field. Let's get started. So we're going to start with our CVP Dressing Kit. It's just actually a pouch, and this is what we would use to do a central line dressing change. So if I were going to do a central line, I will have taken my bandage off. I would have washed my hands. I would have gone through all the steps, checked my order, put those gloves on, take that dirty dressing off. All that would go into the trash. Then it would be time for me to hand wash or hand gel again and open up my kit. So as I'm opening up my kit, there is a flap up here, and you so just gently pull it open. And notice how I always lay my thumbs like this and pull gently so that it's not going into the sterile field. And I always tell students, and this is my suggestion to anybody, always take the entire flat piece of paper, whatever, off and get rid of it. Because if you leave it on, what happens a lot of times is it'll flap back in, and that's broken your sterile field, or you'll touch it, or it'll brush, or it'll flap, or it'll do something. It's just trash. So go ahead and get rid of it. And we have our kit. Now, I'm in my living room and not in the lab doing this actual video, but I still can do it and show you. And just know that you're usually working at a bedside table. Now in this kit, we have a mask. This mask is for me as the nurse that's going to do the dressing change. But I am just going to pinch this mask up. Now, if I wanted to put this mask on, it is no longer sterile. It's gonna go up on me, and it's gonna be for me to use so I can protect my patient as I'm doing the central line dressing change. Then as I look inside my kit, remembering that this outer edge is not considered sterile, but everything inside this container is sterile. So I don't want to touch anything. I want to just think for a minute. I need to get my sterile gloves out next. Now there are ways of doing it. You can pinch, but lots of times when you pinch these papers, it can tear them or rip them. But another good way of doing it, or a trick, is to actually kind of push on the gloves, and it will make this edge come up. And I'm ready to take them out. Now we know that everything on the outside of a sterile glove package is considered not sterile. So I am gonna actually, on my bedside table, just put these to the side because I'm not ready for that. Now I'm looking down into this tray and I see my sterile towel, which is what I'm gonna unfold and lay out to be my sterile drape. So I'll have an actual sterile field to work off of. So remembering that 1 inch around that border is considered unsterile, and anything glossy is the waterproofing that's on that will go to the table. I'm going to get and just gently pick up my sterile drape. Now notice that I have it in my hand. If I were standing by a bedside table, I would want to go high with this to unfold it. But I'm here showing you to demonstrate. So I have pinched it, and then I need to take the edge, the very edge. So I am going to grab the edge, and I am going to allow the drape to come down. I'm gonna actually move my camera up so that you can see this. So here I am with my drape, and I'm going to take the 1 inch, starting to take my drape, opening my drape. Now I've not broken my sterile field at all. I am just gently opening up 1 inch around, getting my edges, making sure nothing's flapping down, I'm not touching the actual table. And now I'm going to gently start to turn my sterile drape and pulling it so that I do not break the sterility. I have opened my sterile drape. Now, if I want to lay this down on the table, as you can see on my table, I have my packaging right there. So before I open this drape, I would want to, and I'm gonna fold it back up to show you something. I would want to go ahead and adjust my gloves and adjust my actual pouch that has all my sterile things in, and then go ahead and pick this up gently, touching just the outer edge for the 1 inch. And then of course, since I've already opened it once, it's gonna open up beautifully for us. And then instead of laying it this way, long ways, I'm actually going to turn it gently. Notice how I do that. And then I want to lay it just like that onto my sterile field. Now I'm gonna go ahead and lower my camera again so that you can see the field. So I have my sterile field, I have my pouch, and I have my gloves. Now, if this were my bedside table, there's no room for me to put gloves on. So I always suggest that don't reach over your sterile field, don't reach over your sterile field, but take the edge of your sterile packaging and just gently put it near the sterile field and up out of your way, opening this area to be able to open your gloves. These are not sterile, so then I can actually open my gloves, and I always suggest, I'm on a round table, so it's a little more difficult, but I always suggest opening at an angle, always pulling taut, and then we would start to put on our gloves. Notice that nothing's really touching or going over. I mean, my inches are barely there. I would not be dinged. And on the table, it would be square, so I'd have a little more space. But I would go ahead, and I don't want to grab the glove or pinch it up this way. Watch my video on donning sterile gloves, and you will see how to put them on correctly. And sometimes it's a struggle for all of us. These good old gloves, you gotta love them. One glove on, and then I'm gonna do the little cup, hitchhike thumb out. Always remember to throw that thumb out, folks, because if you keep it in, you're gonna end up touching yourself and breaking the sterility. 2 gloves on. Now, I always tell my students, go to prayer hands or clasp hands position. You can either pinch this up just like this and drop it into the trash, or sometimes I'm like prayer hands and just go ahead, because guess what? That little piece of paper will not hurt that floor, and you can clean it up when you're done. So when you're looking at this, we have this sterile field, and everything in here is sterile, and my gloves are sterile. So now I'm just gonna pick up my stuff and lay it on my sterile field, remembering I have this inch that's considered not sterile. So don't get real close to the edge with anything, just keep everything kind of center. There's not a whole lot in this kit. And now we're ready. This can be considered trash. If I wanted to move this, just the concept of sterility is what you have to remember. If I wanted to move this, I could take my hand inside. I'm in sterile to sterile. I can't be laying it like this, I can't touch, and just move it gently out of my way. Now, if I'm going to do my central line dressing change, I'm ready to go. I'll need my gauze, and I always like to open everything that I need to do anything. So I would go ahead and open up my alcohol wipes, and I'm going to just drop that as my trash. Be a T-Rex, remember, stay within, not above the shoulders, below the waist. I'm gonna pull out my alcohol swab, and I'm gonna go ahead and lay that right on top of that, and I'm ready to go. I've got my 2x2. I can pick up my line. I'm gonna clean around in a circular motion. When done, it'll come over, drop into the trash. That fell out, do I care? No, I don't need to go scrambling for trash. Leave it be, it will be okay. You can clean up afterwards. Then I'm gonna take my chlorhexidine sponge and my pickups, and I'll be able to engage by cracking, and that means that the actual chlorhexidine will go to the sponge. I'm gonna pick up my line, and that's a scrubbing motion for 20 seconds or more. Scrub, 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 scrub. We're cleaning, getting rid of all of those microorganisms and germs that will cause infection. When done, go ahead and drop into the trash. Let dry. And if you have a bio patch, if you have, we used to do betadine tinctures. Now actually they have a gel within the Tegaderms for a lot, but still bio patches are being used. You would then have that and drop that on your tray. You're going to put that on, and then we're going to apply our Tegaderm, loop up and tape, and make sure always to date, time, and initial your dressing. Just a basic sterile setup. I hope this helps.